Cerebral palsy, you can say in a disease, the way they affect the brain. When we talk about cerebral, brain, a part of the brain, and palsy, weakness. So now the kind of disease where person they get weakness of the body because the brain, either the cerebrum or the cerebellum, gets issue. Brain problem will cause weakness. Now the brain is the part of the body will control practically everything for person body. Yes. So if you get cerebral palsy, that thing be saying that say your brain will control the other parts of the body. Now the cerebral palsy, you get different types. Types. You get one way the muscles for the person body, they always contract. That's that one we call them spastic type, like the most common type of that. Brain just they tell the muscles say make them just contract, then they continue to fire, just contract. But now involuntary contraction, where the person no fit control, like the spastic type of that. And that one, because imagine say if you run the exercise, you run, you see, if you start to get tired, muscle will start to get pain small because the contraction done, so you will fit rest. So but this one, the spastic type, they feel control them. They just contract. You go feel pain, but you know if it stop. Then you get the dyskinetic type of cerebral palsy. Cerebral palsy, you can say in a disease, the way they affect the brain. When we talk about cerebral, brain, a part of the brain, and palsy, weakness. So now the kind of disease where person they get weakness of the body because the brain, either the cerebrum or the cerebellum, gets issue. Brain problem will cause weakness. Now the brain is the part of the body will control practically everything for person body. Yes. So if you get cerebral palsy, that thing be saying that say your brain will control the other parts of the body. Now the cerebral palsy, you get different types where they affect person. Because yes, now weakness, but the weakness too gets different types. You get one way the muscles for the person body, they always contract. That's that one we call them spastic type, like the most common type of that. Brain just they tell the muscles say make them just contract, then they continue to fire, just contract. But now involuntary contraction, where the person no fit control, like the spastic type of that. And that one, because imagine say if you run the exercise, you run, you see, if you start to get tired, muscle will start to get pain small because the contraction done, so you will fit rest. So but this one, the spastic type, they feel control them. They just contract. You will feel pain, but you know if it stop. Then you get the dyskinetic type of cerebral palsy. Cerebral palsy, you can say in a disease, the way they affect the brain. When we talk about cerebral, brain, a part of the brain, and palsy, weakness. So now the kind of disease where person they get weakness of the body because the brain, either the cerebrum or the cerebellum gets issue. Brain problem will cause weakness. Now the brain are the part of the body will control part cerebral palsy. That's where they affect person. Because yes, now weakness, but the weakness too get different types. If you have one way, the muscles for the person body, they contract. That's that one we call them spastic type, like the most common type of that. Brain just they tell the muscles say, make them just they contract, then they continue to the fire, just they contract. But now involuntary contraction, when the person no be control, like the spastic type of that. And that one muscle will start to be pain as well, because the contraction done so you will fit rest. So but this one, the spastic type, they will fit stop. Then you get the dyskinetic type of cerebral.
Okay, my people, now good afternoon. Today now another Saturday. Now welcome to this our podcast, Ability Inside Disability. I know I don't know this face well, but I know so new people don't join today. So make I introduce myself again. My name now Mrs. Modupe Afiz Ogun. I'm the CEO founder of Beautiful Hands Foundation, where you get this podcast. And as you know, this podcast that will talk about learning and intellectual disabilities and how these conditions they affect our families, society, and how people with this condition too, how they go through so many challenges because people don't understand what the condition be. So for this podcast, we talk about the conditions, why they happen, and how we fit to support people with this condition and their family, because all of us belong to this our country, Nigeria. And even though they get this condition, they still get what God take bless them, where they fit to help themselves and still participate for see the flyer we will share today in a very, very interesting topic. Now, no say for this place, they try to talk about things where we cause this condition, so that where we feel avoid them, make we avoid them well, because what never happen if you feel avoid them, it will make things easy for everybody. We know say what God don't write, He don't write them, but God still give us wisdom and knowledge to take know things. So the thing we will know say it go hard for us, and solution don't do for us even before it happen, make we choose that path. So today topic now, how blood group fit cause this learning and intellectual disability, where we start this podcast because of her. So the people we will get for our brothers and sisters who will get for studio today, one face they very, very familiar. Dr. Bapo not fit come today. He said, "Look, I tell you, and I say, make we have no verse, and I go see face next week." Dr. Kumtap they here today. So Dr. Kumtap, over to you. Who be Dr. Kumtap?
Hi, people like this. Greet you now. Good afternoon, everybody. We don't come again. We don't show. We hope say today we're gonna go learn more about ability inside disabilities. My name now Dr. Kumtap Yilji. I be cardiologist where they work for Jos University Teaching Hospital. I come be chairman of Nigerian Medical Association for here at Plateau State. Thank you very much.
Okay, my sister, Madam Temitope. I don't
Aiso.
She go introduce herself by herself, tell you now her full name, who she be, and why she dey here. So, Madam Temitope, my sister.
Oh, na good afternoon. No. My name na Aisoseka, and I happy say I dey here well. Now the first time where I dey come here be this, and I be teacher. I dey work for school. I be school administrator, and then I can't be the founder of the Rare Resource Care Foundation. na the people we get rare resource factor, negative resource factor, na we be the ones wey be A negative, B negative, O negative, and AB negative. So we dey come together to make sure say we no die because blood no dey. So we dey come together to look for blood for each other, and then we dey also educate the younger girls with the secondary schools, because now women e dey affect pass. So now wetin we dey do be that.
They're my very big brother with the MC. Who don't know MC Yogi from? If you want laugh, me they tell you from first-hand experience now. If you want laugh, don't miss any MC Yogi comedy show.
Thank you.
That's what I do for you. So
Thank you very much. Thank you very much.
I just do advert just like.
Because they don't say car we don't get in. I got them up for fly. I don't call you the way I did. I go don't do it for you. Mama don't talk about someone. If once you want laugh, I did for you. I give dosage. No worry. No overdose only did for this. I would laugh for the child. They give people for here.
So my people, MC Yogi, in fact, now he make me really know about how this condition be, because the first time when I hear it from his mouth, I never understand before saying all this A negative, O negative get wetin they fit do for person, but the way we say, you know, go there to na real stress in some instances at some point for person life. So and I can't tell myself say today we will talk about this condition, especially because 14th now today now be World
Blood Donors Day.
Blood Donor Day. Now know the benefit to the donate blood. And also now go here later. This blood matter now very important matter for everybody, but especially this group of our brothers and sisters. We get this negative. So MC Yogi, explain yourself. Tell us who you be shortly.
Yes, ma'am. I am. How we don't shortly. So shortly. My name is MC Youngee. I be stand-up comedian. I be MC. I be compare. I be act. I be write script, and I do into storytelling also. And I also get the resource negative factor. I be AB negative, the rarest. I like talking with pride because now we be the rarest blood group for the world. Like globally, we never reach 4%. We get that blood group. So before God go carry and bless the world, the first think where. When they say more fair talk, when Dr. Yilji be the talk, all they get baritone, they show himself. I can't be like both of thanks for to get baritone, no be when you dey stand there for exam hall, you know if you ask question.
You dey use this one, then they pay small. Don't use that kind of sense. That cash will collect for you. You dey pay by comedy.
And my account number
You see the poster for Juto in the company. Very humble. You just call it hair voice. Please to meet you, Cousin Sir.
Thanks, here.
Thank you very much for having me. My first time for your program. Me, I join online. I did my watch, and sometimes I go hear some kind of English. I don't drop before say, oh, more English choking. I did hear it too now. And thank you so much for all the things what don't learn from now. And they really do well.
Thank God. And I thank God say una fit make time come today because una fit do long work to say give people awareness on the benefits of blood donation. This blood donation, don't say me I never donate to, but now very important thing because people feel die because of it. So I go start with Dr. Kumtap. Not me because I want make una experience small. President, most start with president. Most start with president. Respect the president. May not be say tomorrow they go say they not get time. So Dr. Kumtap, yes, what will be this resource factor for layman English? What do you mean? For woman where they village or man where they
yes.
I got you understand that.
So we suppose what will be resource factor? Make us start with blood first.
Yeah, blood.
Everybody gets blood.
Yes.
All of us get it. And the blood, the waiting they constitute that blood. You get red blood cells. You get white blood cells. You get platelets. Then you get what we call serum, like say that the waterway, the cells they swim.
Okay.
So now waiting they constitute blood. and each blood or every person gets his own particular type of blood. Where we don't they group up. You get waiting we they call the ABO grouping system. And like they don't talk. See, you get blood group A, you get blood group AB, you get AB, and then you get blood group O. Then under that one again, you get waiting they call rhesus classification. That one they dependent on you get waiting they call antigens. We not like
protection.
Yeah, make us say more use protection. More just look like say now you build house, then you fence
security.
the house. Security. Now as you fence the house, you get some people where they put those wires on top. So now those wires they call them antigens.
Now super protection with that one.
So more talk say the wires get different types.
Yes.
So now the rhesus.
Okay.
You get different types again. You get type C,
Okay.
you get type D, you
Okay.
get type E. But the one way commonly we science understand very well are the type D. So person way get type D. So you build house, you fence up, then you get type D rhesus antigen. Then they call those ones positive.
Okay.
So the person go fit they get blood group A and then you get positive.
Okay.
If you get blood group A and then you get B negative. So we could assume say the blood grouping now the first.
Now the first.
Then the rhesus factor, the D classification.
Now the
The
wire.
wire.
So we assume say the type of fence they different like the A, B, like the A, B and then A, B and then O.
Okay.
Then person will get the wire on top. Now positive. Person will not get
We don't get the wire now negative.
So if you don't get the rhesus, the D rhesus factor, now them they call negative. And then be the rare ones.
Now we.
The special, not the
Now the special people.
Now we.
That's special.
We
They're
got
very
favor.
important to us.
because you see
Now
say
we-
them, they don't need wire.
They're fine.
For us when we dey positive,
We need
I
wire.
don't put wire for us.
No problem.
So I think that now I don't know whether
Yes,
I
yes,
just
yes. That wire fence.
So now
Yes.
essentially now waiting rhesus classification.
Okay.
It get implications where I don't sure say we will talk about that
Yes,
later.
yes. You know why I like today guests and today topic we say the guests will come, they be guests, all of them get first-hand experience. Dr. Kumtap he trained for this field, so he understand that and he dey see patients. He don see patients tired with different conditions wey dey relate to blood matter. Madam Temitope, she in her first hand person wey get the same condition.
Yes.
And my oga MC Ogun, I mean, in a proud owner.
Very proud.
Of the rarest of the rarest.
Yes.
Okay. So, Madam Temitope, what it be? What it mean? What it be the implication? What it happen to woman, specific woman, when get this situation, this negative, negative.
Na negative. Na negative.
Blood.
Yes.
Because I will remove that resource now. Make my audience not say.
When she has a negative.
Negative blood group.
Yes. Okay. I go use my experience.
That's always the best.
I go use my experience because I get experience well for this thing. I marry 2007. So 2008, I get belle 2007. I born 2008. So I born the pikin actually. The pikin dey okay after I born am, but after sometimes I feel like say the pikin dey stressed from belle, and so I lose that one after some hours. So after that pikin, I go get belle, I go get miscarriage. I go get belle, I go get stillbirth. Carry another belle, I go get miscarriage. So I lose 3 pikin after that one. So I dey go from private hospital to private hospital. But when I can't get belle for my first born wey dey now, I can't say make I go jute. Make I go teaching hospital, see wetin dey happen. Wait, because people don dey tell me make I go mountain, go pray, make I go beg anybody where I vex. But I say to make I go hospital before I go mountain. I can't go jute. When I go jute, then do test. They can't say I be O negative. I tell the doctor say no, I don't do this test like 6 times, so I no be negative. I be positive. Now positive results now then they give me since. The doctor say the result will come out na negative. Make I come out, make I go do am for another place. So he give me like 2 places. Make I go. So I go do am for the 2 places. They say na negative. I go do am for another place. They say na negative. So now the problem be this, since all this while where they carry belle where everything go just they come out. So now that time I can't say make I even know waiting this thing be, because I don't hear about them. You know, say for school they know they really teach us all these things well. So I can't read about them. Can't see say it gets the way where your body go develop antibodies that the woman, if you carry positive pikin,
will get
positive, yes.
Type will be positive.
Yes, as me be negative.
Can't get positive.
My pikin can't be positive. So if that pikin be positive, so it be like it be say as I born that first one, my body don't desensitized. I don't know how I go take talking for pidgin.
Your body don't
tell me say it be like say it get danger will enter my body.
Your baby na danger now.
Na danger because say na positive. So anyone we can come, my body goes come tell my body, come tell and say this another danger don't come. Oh yeah, attack. Now so you go push the pikin come out. So all the 3 pikin we enter, we come out. Now because of that one, now it get waiting the feed do. We go calm my body say okay, will no be danger. You know, you get one injection we then they call Rogam. Where they go give us within 72 hours after birth. That's first day, second day, you must take it within 3 days. If you not take it within 3 days, it no go work again. So they will give you the injection. It will help you with the next pikin. Now so it go help with the next pikin. So even if now 5 years you carry pregnancy, it go still help with the next pikin. And you go need to take this injection every time we be saying a positive pikin you carry.
How you go to know say na positive pikin?
Because then go test the pikin when it come out.
So once the pikin don't come out,
yes, they go fit test them.
Give you the injection.
Yes, they will give within 3 days.
Okay,
they say they fit give them within in 28 weeks. But I know say doctor will explain that one well. But within 3 days after you born. Now after you born means say if na miscarriage, you must take them. If na stillbirth, you must take them. So that's why it is important where we dey go school to school. They tell these younger girls say, see, no live your life anyhow, because no girl will go do abortion now we go say you won't take the injection. Because after you don't abort now, you no take injection and you be negative. By the time when you marry, now that time it go begin manifest. So now my story be that.
As you take explain them like this, as chairman of Nigerian Medical Association, I don't give our associate doctor.
Now you look careful. I'm going to associate patients.
Oh my God.
And Youngie never studio today.
You don't hear another title.
Thank
you.
God bless you. Yeah, make we hear from our.
So for men, they know they really get challenged. But you know, say most time when they talk serious problem no concern you, know me say you go turn back. You go help those who need help. Because when I even realized I've been negative blood group, we go run tests. The person will already run the lab. He see the result. I tell my father, someone I go come back tomorrow. My father said, no, tell me into a day.
What be the problem?
I call you look myself. I call you pitch myself. All right, now what be the? I just blood group because check. What can be when I go come back? You must see the result when they see. No one conclude.
Yeah.
Me no go give me the wrong conclusion. I say no, Allah. But I go do okay. I be say I go do okay. I say no. I say me swear. They call laugh say no, you don't read that one. I say no at all. I know my mind can't dey skip. I can't dey want. My day I can't dey ask how many blood group them dey where they. I never know say negative day. I don't know so we get A, we get B, we get AB, we get O. So I'm not to say, and before that I would just assume say O, na universal donor. I would see them. So go back there the following day. The lab technician can't tell us say na AB negative. Say na very very rare blood group. Now why no one rush? See if others check the result, they will not tell you say na positive. See when guys taking time run the test himself to confirm say CRCB. So I see run I can tell him say you are AB negative. So every other place I don't go after them. Most of the places I don't go. Some places they don't tell me say I be positive, but most of the places I don't go, they tell me say I negative. So I don't know. So those who do due diligence, when you just rush conclude, they will tell you say CRCB. Cause I don't go to donate blood before they tell me say na AB positive EB. I don't understand because na need blood sharp. I don't know time do anybody feel do this, but that man convinced me well. Say he took his time to sit on the test and maybe to make sure saying get the result. And then if me will be man just did the way I did, I can't go marry woman will be negative. If you don't even get issue, I baby feel be understand. But then because I be negative, let me say all my siblings go be.
All your children go be.
Let me say all your children go be. My son today na B positive Yes. So you understand. So the children now, if he be B positive, can't go marry woman will be negative. If they can't they get picking, can't they get this kind of issue? You can't be like say
Wish
why now waiting there story there they don't tell woman say then guys go flog you for top of that. If your pikin no go stay, yes.
I mean are you the
see I was president for you.
I know the one
people dey go tell you say the guys flog you on top of that so that the pikin when supposed come there to say they beat them. You know but women don't suffer so many. Like young girls they don't commit the act of abortion without having to know their blood group and then taking the injection so that when the next one come their body no come they fight the pregnancy as enemy because I waiting the body go dey and the body now why the other auntie I mean na uncle Jean
na serious
why na auntie so why those auntie genes dey there they all na just to na the army wey go fight the enemy when they come so if men say they no go wan pull mouth make dem learn stand by the women wey need to know all these things and make the men too get the knowledge because not only those wey be negative need this knowledge.
No, everybody
need because you no go know who for your family you go get the negative blood group and you go need just simple question when you don't happen you just ask what is the blood group. It don't help. It don't solve plenty problem. Because sometimes you carry put on top doctors' head like say they know, but you know see plenty things they did their head at the time. And now waiting their eye they see. Now they work with. And before you go feel from you go not go right say you be positive. So you don't misinform them. Now information where you give them, now they give you back. But if you do proper tests, you know this thing. Nobody say you're under pressure. You know your blood group. When they ask you, you go act right. I hope with this few points of mine, I've been able to convince you, not confuse you. That president will give more associates.
We will deliberate on that. We'll deliberate on that. That's your own. You're under consideration.
You're under probation.
You know, past 3 months.
People, I can't comment their call for that. When I ready, so all this one I don't talk so now. The thing with in my head since when I decide to discuss the topic, is saying, you know, AS and sickle cell. Before very recently, people go rely on say they go pray, everything go fine. People go rely on say it no matter when we reach that bridge, people
go cross them.
So people know they will reach the bridge, they don't walk out because the wahala way they from where they dey to the bridge is too much. So to come cross them now, they don't get that strength again. So from all of this conversation now, apart from say the young girl do abortion, from my own understanding, I feel say as it dey important, it dey very very important. Not the only AIDS and sickle cell now we go dey talk now. Clearly, blood group na very important factor
Very
for
important.
two people to check before they marry.
That's so.
Abi I lie?
You don't lie.
So that if you be negative or you be positive, at least you go don't know the one, you know where you dey. The person wey you wan marry, you don't know where you dey. If na person wey go need that injection, you go don
Go know.
prepare your mind.
Yes.
But our president, why e be say you no dey get correct result one time?
Because as they talk now, I should tell me him own or her
And she
own.
talk her own.
I can't remember my own. Because now, if you ask me,
Una plenty for
if you ask me,
Let's bring the results.
we even dey test my report, we test my
which
own
blood
because
group
Yeah.
I be,
You go
I
first
will
think.
tell you say if you be A, if you be O,
Hope.
okay,
because two labs don't give me different.
the result.
I don't dey procrastinate say I will
Go check again.
Yes, I will go look for hematologist, that's specialist. Let
Okay.
them collect my blood.
Then do one.
Okay.
Because when I've been they grew up since I think I was 18 or 19 when I do blood, they tell me say I be O. Until about 3 years ago, when I do another one, then I can't see say I be A.
Hey.
So sincerely speaking, I don't know if you ask me, I say I go fit say maybe na O, maybe na A. But if I hope say I no go need blood, but if I go need blood, thank God say the guidelines have been say before they give you blood,
They go
you
test.
do
Yes.
But
So,
even with the guidelines, you no go switch.
what you then get? So they get issues, and some of the issues now be say one, reagents. So reagents will expire.
Okay, the reagent wey they use to they do the test,
Yes.
dey
Because you
expire.
get reagents where they go put. They keep talk say okay no this one na A, this one na B, this one na AB, or this one na O. Then you get things where you talk say no this one na rhesus positive or rhesus negative. So the reagents, if you leave them for sun, even if na good one, you know preserve them properly. Na problem.
Just like vaccine.
Imagine say dem carry reagent from Lagos, car come spoil for. They talk say make I no be say I dey.
I want to see me use all
Bogoladan
of
because
what.
their son too. Can't spoil for Lokoja or Bogoladan.
Aha.
You do 2 days,
There.
sun, heat am. That's the problem.
A problem don come.
Serious problem.
That's one. Two, which I no go talk say na that one this thing because no be very difficult text. So I go no go talk say na technical expertise. Person no know. Because I expect say any lab where you employ person, so blood group and zero na simple, no be very difficult. So mostly na issues
Of reagents.
of reagent. Now waiting, I will talk with that. And just to highlight waiting, the doctor, just to add to us waiting for people we he talks here is to the special people. I want add join saying a very special
Group of
for men. particularly.
Very.
For the men, for the uncles. Because the aunties too plenty. For the men, because for hit now where they rhesus negative.
Yes.
Even if you marry person with a rhesus negative or rhesus positive, he want
No wahala.
Ah.
That's what we solve issue, family issue.
But for her now,
Yeah.
if she marry person with a
Positive.
rhesus positive,
Na problem for
problem.
her.
And unfortunately, the pikin can carry
If
In Papa own.
some of the problem.
Problem go dey with that.
Yes. So now the aunties go come gather, just they deal with
The pikin.
With the pikin.
So for her, unfortunately, it just the miscarriages or stillbirths. Some them go give birth to them,
Yes.
but they will come start to they get problems.
Exactly.
Where you get something we they call canictels. So as the red blood cells they like this, so the antis now, the antibodies will come they damage the red blood cells. Just as sickles they, the red blood cells they damage. So if they damage, they release what they call bilirubin for the blood.
Mm.
The thing come plenty. It will fit the cause yellowish discoloration.
That's jaundice.
Jaundice.
If that thing plenty, can't go stain part of the brain. Aha. It's a problem.
Now they are our own.
Yeah,
Our own will enter.
so I just want to add.
No, you don't really go where I want to ask you. Okay.
So he make I add to wetin he talk.
What's the problem?
Yes, because when he talk about jaundice, I remember say when I born my children, I get 2 boys. So when I born my children, they no even wait make it come off for their eyes, but because they know say me I be negative, the children are positive, and that's resource incompatibility dey. So then carry the children blood, test them whether they get jaundice, and the 2 of them get. In fact, I be like saying like 5 to 7 days now we dey spend for hospital before they discharge them. So it is very important say when you know say you be negative and the pikin where you born na positive, hospital where you go, make you just tell them test this pikin, make e no begin dey show for their eyes, because some of them me na CS that I take born, so I go dey hospital for some time. If na the people wey they don discharge in a day wey dem go house, when the pikin begin get jaundice like that, if you just put am under sun say okay e go. But this resource incompatibility wey we dey talk wey dey cause jaundice for, e dey important make dem check these children
For hospital.
for make them dey under that. Yes, phototherapy.
Okay.
So if the level plenty, you get what they call exchange blood transfusion. So they go come out of blood, then put on fresh blood. So you go dilute. Because if you plenty, you go come. We don't want to make it touch the brain. Because if you touch the brain, no problem. So somehow we know they wait, say like this injection now. Because now, as you talk now, how many people they rhesus negative?
They know plenty.
They know plenty. So if we just see woman just come do this thing, they don't know say her husband now positive. No, we not go wait say we go do
test for picking.
Injection.
Now fast.
Because imagine they talk say
Why she still get the belly after she don't born?
no, they do either just before pregnancy, but it must be within 72 hours of delivery. It must be the
Latest.
Yes.
It must be within 72 hours. With the advice that day at the beginning,
They take them.
Injection.
Yes.
Before the antibodies go grow.
Yes. Because that's sensitization. Now very important thing. Imagine say they can't rob you. You know, say if you breathe and rub you 2-3 times.
They're not gonna stop again.
So now like this same thing. So once the woman body don't they sensitized by that rhesus positive pikin, it's subsequent pregnancies.
No go stay.
No, go stay. Because the body don't they fully attack now. This one
Enemy don't come.
This witch labor, people don't suffer under.
Yeah, people don't suffer.
Who's on which we call this? I will not look like this. The call also now will
And I sure say this thing go down, they go on for a very long time, because they talk saying that game is carry, but they don't know waiting they happen. Yes, they don't know. It don't day.
She had to lose how many pregnancies?
But you talk about it just now, madam, and people they talk this thing, even from my own personal experience. It be like say, to a very large extent, so they go teaching hospital better path.
Specialties.
Surround you.
Yes, inside one hospital.
I agree.
I agree.
The tertiary hospitals,
Because if to say na teaching hospital, I rate
Yes.
private to public.
Yes.
Like that. So, na free or you must buy am? Huh? There be rare case now. Why not go be free?
I don't feel remember the exact.
And you know cheap.
Now like 75 now.
75,000.
Now, ba.
But they will give.
Because not be waiting they happen all the time now.
It dey happen, no.
It happen.
Mm.
And
No, I mean the population wey not sure say go there as impactful as the other population is.
yes,
Mm.
you just brought up something that I think we'll look at it.
I bet.
You get something waiting they call. So that one, if you get obstetrics complications,
In pidgin English.
Wahala come from the, because of the pregnancy.
Yes, na free.
Okay.
And if you look at this one, we go fit advocate
agree.
say
Make
may
you follow for-
Yes.
so that one government will take care of
Mm.
this thing. Anybody will come with road traffic accident. So if you get accident, they carry you go any government. So if you come hospital with gunshot injury, then go
Na quick.
no, government will handle
Government hospital.
Yes,
Government
for government hospital. If
Quick attention.
2 weeks ago to inform people say see this thing, but we will continue today.
We will continue.
Let people know
We
say
will continue.
any of these 5 conditions.
Yes.
Woman will get pregnant, will get issue.
Yes.
Gunshot injury, and
Yes.
any pikin will be under
Yes.
5 years of age.
Yes.
Government will handle.
Okay.
That one good.
So we
This
go advocate say
Yes.
since the population way
They-
of
they
women
very
wey
small.
No plenty.
Plenty.
And
Mm.
plus, no
It's
say
supposed to-
the chances of danger occurring with women where no even they informed, they very high.
Yes.
So that
Yes. Mm. Yes.
Advocate and then plus globally with the population of those that get negative blood will not even reach 30% of the global.
Yeah.
So
So in turn you may see that
Our
only one
president.
woman or two.
Yes. 9 gets 9 be the negative.
This one.
We go follow up.
We will collect number.
This na benefit of
Amen.
Just use their platform.
because you see apart from say the issue of say okay the pikin na e go become problem for im mama for the intellectual and learning disability side now see condition like cerebral palsy.
Mm.
Yeah? So this na wetin you fit take show them say okay if we fit help arrest this situation make am easy for mothers to fit get access to this injection at least you go reduce the number of children wey
Yes.
go come with this condition.
Mm.
Then
True.
another one be say intellectual disability even to the waka motor problem plus hearing
They affect
hearing loss plus developmental delays. This developmental delays now sef if we even go enter autism.
Mm.
Yeah, because autism na neurodevelopmental condition. E go where e no suppose go for inside brain. E fit affect autism go come. So why if we fit prevent the occurrence of this kind of situation, we no want me we get plenty children manage these children for life.
no, na chicken change compared
Na chicken change compared to
Wetin you go
injection.
spend? Yes.
At least if this group of people fit dey 70% clear of the possibility of having children with all of these conditions. That one don comot. That one don comot for statistics. Then we go focus on the other one.
Mm.
Oga President, we don give you many analogy.
I don't carry am.
Three of us now make we dey drag am from one places and dey pray for am. And dey pray make people wey go dey talk to make dem
Make them hear.
because there plenty for the road.
No
Not
be lie.
only
The chain
Na
long.
true.
Aye,
long way
because God dey front end and middle
True.
by God's grace.
True.
My people, una I like this. I hope say una don learn well from all of this talk wey we dey talk so. I talk these conditions just now wey fit happen, but I want make Dr. Kumtap help us explain to us how e fit happen because of this negative blood group.
So, like we don't talk earlier on, saying if rhesus incompatibility, incompatibility,
English incompatibility mean wetin so.
means say
They know they work together.
The
Disagree.
blood group different.
They no gree.
But this promotion now, you don't go review how.
my powers vested. I will give a professor of English because he don't take down.
Nothing medical.
So the blood group, they compatible. They know they agree join.
Yes.
They know they agree join together.
Together.
So one of the consequences might be say the red blood cells would they easily they break. So red blood cells now like they more just imagine saying a ball, small balls where they inside blood, where they swim inside blood. So you know, as we see ball, air they inside. So if the ball bursts, air will come out. So we'll look at the air as waiting what they call bilirubin around 20 days.
Okay.
Yes.
Where they stay before they die.
Before they die. Yes.
Around 20 days could be 4 months now.
Yes. So about 3 to 4 months.
3 to 4 months.
3 to 4 months now.
Okay.
Now their life cycle. If they reach that time,
They go die.
Then will release the bilirubin, but the liver will not pump.
What it bilirubin be now?
Bilirubin is just a pigment within the red blood cell.
But not dirty, but you not do that.
No, but it's small.
Not too much.
Not too much.
Okay.
If it plenty, you know they good.
Okay, so that
Then
makes
they
the
cause
liver more
jaundice.
cleaner.
Yeah, so the liver usually they cleaner, they more powerful. But if the thing come plenty,
Too much.
yes, because of incompatibility. So incompatibility now, they will just they destroy the
We
red blood.
destroy the process. Okay,
You
all of
become
the red blood
thing
cells
go
go
just
just come out. The bilirubin go just
they
pour.
come for the liver. And you remember say this thing don't they happen for either the fetus or as the born newborn baby. Where the liver never even
Develop.
Inside the newborn baby.
Mm.
Okay.
So because even before delivery, then they fit identify some of these things.
Okay.
Yes, because you get one condition where they call hydrops fetalis.
Okay.
So now the baby inside mama womb, but they get water plenty for the body. So they go physician for Doppler ultrasound scan.
Okay.
The body will swell small.
Okay.
So now pointers.
Okay.
Yes, so now some of the things where we defeat.
Okay.
Identify.
The baby go come out like that.
Yes.
For the ultrasound.
Go
So
just
now go
right
not
now,
say
water
the fluid too
too
plenty.
plenty for the body.
And that fluid now that thing where they come out from inside the red blood cell as they cut out.
Part of it.
Part of it.
Part of
Okay.
it, yes.
Okay.
So if the bilirubin come dey plenty, if the liver no fit more am up,
Yes.
e go start to dey deposit for different parts of the body.
But they enter different parts of
Yes.
the
So
body.
if you come high, because
Because eye loss.
you always declaration of jaundice.
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 Because jaundice.
Okay.
For newborn babies, e dey deposit for the skin.
Okay.
So now why if the born baby, we go fit just press the person forehead, baby forehead, then we go talk say jaundice dey. Because you go see say the baby go dey yellow. Or Igbo people, they easy. But for black person like me, I know. Yeah.
You reach black, you are senior colleague.
So for all that we dey very dark.
Yes.
You know the very very. But we dey talk about Pekin.
Yes.
So most Pekin there, you can press am, it go show for skin. If it too plenty again, then it will go the basal ganglia of the brain. Then it will go the deposit. And for it even deposit for heart. Yes. So if it deposit for heart, you get what they call SA node. So if you go stain the SA node, the baby heart no go dey beat, it go dey slow. The baby heart no go dey beat as it's supposed to. So if the baby heart supposed to beat say 100 times in a minute, the baby heart fit dey beat 50 times. So if the baby heart no dey beat normally, it means say blood will no be enough blood will dey go brain. And if blood no dey go brain,
The brain cells go to die.
na problem. Come join am with
The one wey
dey
directly inside the brain.
deposit on the brain. So if you stain the brain, you will come start to damage nerves and neurons for that place. So of course, anything will go damage the brain will affect the developmental milestones, learning abilities
Yes.
of the picking. And how disabilities will start to be shown.
So they should.
Depending on which part of the brain we
damage.
damage, now where the manifestation
Go they show.
will be shown. So you go fit see person because it plenty for the motor neurons. Person will go feel work and cerebral palsy.
Possible.
So different presentation, but ultimately, now the incompatibility they cause this small thing.
Yes.
They
Say this blood and this blood.
No
Nothing
no
together.
grey.
I cause all of this. When I check on our blood group before I marry, love don't watch this one.
You know, like, but the thing be say even if they check, they still feel marry, since they don't know the solution of the
yes, because check before you marry. So
yes,
you know the
you go, yes, you don't know the solution already.
Because if you know they're prepared for it, the stress and the ignorance.
Yes.
If you make decision when you be say what you feel solve, you throw away everything. And not be only two people they marry now. You not if you understand that family not understand that.
No, so
other world, psychological stress. When you carry this one not go feel born, but it's not like that. So that is why just like AS now and AS. The solution be say no marry AS.
Nah, so
I mean the best solution.
Now the best solution be that.
That time love no go.
Love no go. It's not good because love no dey stand the own. Love you need water, and that water if the dirty too plenty for inside that water no go do anything.
Yes.
So every situation need balance. If one too plenty pass wetin the situation need, it go stress everybody. That is the point here.
The good thing I say science don't help.
So now money come be problem now. So now our government now go help for that matter. Because at the end of the day, health now very, very important matter. And health now wealth. Okay. My people, they don't tell me now say our time don't go far. But I know say we don't talk plenty. We don't play plenty, and we are done. All of us.
Look, I don't know whether my brother don't marry, but
he don't marry.
Oh, I will do advert for him small.
Say no get wahala.
So we need any man that be negative.
I want to beautiful house studio. If I want to marriage counseling session,
yes, it's a beautiful house. This is not just for those when they get cerebral palsy and all those things. But now when they call it a beautiful house, they get plenty fingers. You need to arrange this guy. You use other fingers. Do what you're supposed to do. Make it solve the problems right there.
Oh my goodness. Now do well say when I come today.
Thank you so much.
I know say our people get plenty questions. Although our question and answer sessions now last Saturday of the month. Anybody send question? No question, Abi. Okay. I get very, very structured listeners. That's nice. And also the topic now very interesting. So madam, from your experience, advocacy and all, as mama, because us we be women, mama, mother, all our experience, they pass the condition where we get.
Yes.
We feel they relate to almost everything we do because of our role, our natural role of nurturing, raising. So what would be your advice to young girls, to mothers, and girls who never marry, those who won't marry? What would be your advice to everybody?
You don't talk them before. Everybody guys know their blood group. It is very important because when I want marry, where they say make I know blood group they part of the test. I say waiting blood group they do. If na genotype, HIV, that one they okay. Waiting be blood group. Now when those things begin happen to me, now then I know say, and the reason why they carry these tests go meet the younger girls with that. When they go schools, we go talk to the girls, we they test them. We dey test them, we dey do blood group test for the girls. Yes. So when we see the ones wey be negative, we carry their number so that we go dey follow up on them to tell them say make una no live una life anyhow. So parents too get very serious before, and she said they don't tell her live your life well, because if you go do abortion, the thing wey go, because how many girls go get money to buy injection? 75,000 naira. Let's even say it's 40,000 naira. How many of them get money to collect injection?
Buy that one. You need to get the knowledge.
You need to get the knowledge to know the blood group be this, and the dangers be this. And now waiting Red Resource Care Foundation they do be that. We they try go the schools. Natalie, they very important. Make them they go antenatal, because now for there I know say I be negative. Now antenatal I go where they tell me say I be negative. So I no go just carry belle sit down for house say okay I go born am for house. If I born am wey my body dey sensitized, so wahala don come be that.
So our MC Youngie,
Mommy,
from what be advice wey you go get for our uncles and our daddies.
These fights, you notice they don't say if you feel say you don't protect your house finish, you can't stop for there. You know, take care of your neighbors, so they are nothing they need to do. When it's spoiled, it will come back to you.
You go enter your house.
So this battle not be for just the women alone, because saving life now one of the most important things where every human is supposed to carry for mind anywhere where they go.
Yes.
If you just there on transit, they travel, go somewhere. Nice side conversation, you go just say this is what you need to do. What that information you just share will save life and you will preserve generations. So you know be something where you just say, I know say any blood will carry me, I do okay. You need to. What if you be? What if your sister can be affected? Or your child self? Because if you carry that message, say no one know when you go reach your house, you know you don't pay attention. Because nobody they look out for. So more just beg, try make sure say you get tested. Encourage people to get tested also. Plus more just talk about the fact say we get community where in case you need blood, if you just reach out to us anywhere for the country,
and if you be negative,
we were the Abuja, the Calabar day, so that if we just reach call them because that blood type maybe every blood they collect. Person get positive if you collect from negative. But who get negative?
No, if you collect from positive.
So you must collect from only negative.
Yes.
The one way was passed now, all negative.
All negative.
All negative now only that.
Now only that all negative they fit collect from.
So una need enough blood bank of all negative.
Yes.
My people una here, mona encourage people make those way not fit watch join us today. Mona encourage them make they go watch this video. If there no person wey be all negative. And if you donate blood, may you go donate. May you donate, may keep and there for another person we will come leader. Our media organ, we go feel leave phone number for our listeners. I be make una call una phone number.
Okay,
if they need to talk to this resource foundation, they go no number where they go call.
So if you be resource negative person.
Person wey get negative blood
group. When you be O negative, A negative, B negative, and AB negative, you fit join us. You fit join us. My number na 080 688 63668. 080 688 638. We go add you to our community. Now loving family.
Yes.
We love ourselves well.
Because this work una dey do not be small work. So our president, now you go talk final from as doctor, as papa, as person wey dey experience. You don't see different kind of condition. What will be your advice for this matter we talk to all the various parties plus government self wey dey involved, all stakeholders?
I think they don't talk everything. Me, I go just join mouth for government.
Okay.
I can't remember one scenario where happened over 20 years ago.
Okay.
Where I been get one auntie. Unfortunately, she's late. We are O negative, and she been require O negative
blood.
Wow.
I remember say then they look for one from people. Then we will go get one for Pangshin. I've been a mango that time. And like this we go carry and transport and come do that. So this set of people now, very special
Group of people.
we government supposed to protect
Yes.
at all means.
Yes.
Because now like lifeline.
For them.
Lifeline to people in need in terms of blood donation.
Yes, blood donation.
And then them too, even on their own, particularly the women,
yes.
they are at risk.
Yes, risks.
So whatever we government needs to do, policies we will
Help
support them. Now waiting we suppose they advocate with that. Them on their own, their foundation, they do
amazing
great.
job.
They do very good this thing. And I hope say when I will come NMA.
Yes, Nigerian Medical Association.
We go come.
Because this
We define them.
This matter.
That's very important matter.
Yes, as we talk about it, they look very small.
But it's not small.
It look
Not small. How you go carry pikin for belle? Your body go dey tell the pikin. The body go dey tell the pikin say the
Make
pikin
comot.
make comot.
So now waiting me, I will just.
Thank you so much. Una do well.
Thank you.
So Dr. Bako, talk to our people.
You know they.
No, our audience.
Okay. All right. Thank you. Say when I sit down, hear us. If when I get questions, just send them. Come our YouTube channel. We will respond.
Yes. YouTube and Facebook.
Yes, we will respond to our questions, and we hope see as my brother don't talk. Say we don't convince una. Say I hope say una don't understand waiting all these things be. We join hands, take proactive measures. Talk something. Say you no end for your house. No just protect your house. Make you protect your neighbor. If each one will teach another person, then the world will become a better.
I call you Dr. Bako. They miss Dr. Bako. No, now Dr. Good have talked finish so Dr. Bako. My sister, Madam Temitope, that one of my skin name.
Oh, lovely.
Now me go pay. Now you go pay.
If I say now you go pay. Now me then get first give the name.
After all. I better talk to our people.
So,
final comments.
My final comment be say now the things where we dey talk since. When we work out today, we tell them say you know your blood group. Some people say no. So go know your blood group. If you don't do am, you fit go again, make them do am for another place, so that you go sure say now wetin I be this, and then the wahala wey happen to me no go happen to you. May you go do your blood group today. I mean, may you go tomorrow or Monday. Shall go know your blood group.
Exactly. Thank you, madam. Thank you, my sister. MC Youngie, now your turn now.
When we talk about protecting your community and yourself, this platform, the platform where you're supposed to protect also. No keep this information to yourself.
Exactly.
Share the link for your WhatsApp status. You say drop comments, drop your questions, or make we hear what you want to know about them. And the program happen every Saturday. I be MC. Most times you don't know. Even if I do wedding, I will just wait for the link. I will share. Because you go know who go. I said the 2 editions where I been get time while I listen. I learned. And now they come out from our heart with now they teach and they really sweet us. God will continue the best now. So I beg anywhere you do. Make sure say you test yourself and don't forget to share this information. Now YouTube, anybody feel learn. And you don't even know who life you don't save by sharing this. So share this particular video now. May God bless you.
Thank you so much. My people, now do today program, me in school now I come. I don't know say blood group they do this one way they happen to, but if what you don't know, but now we know. So because we know, we will not hide them as they talk. Make we share them because Dr. Dr. Good have come out for your house, come out for everything we get to do today. He comes studio because of una. MC come out because of una. Madam Temitope now waka dey waka since to take advocate for this condition. They come out for inside son. Come here. Come dey talk. Make una do una own bits. Una share these links. Blood group. Not everybody get blood. Not everybody get blood group. But not everybody know the thing where two blood group where no join together fit cause. I beg una, may we save people life. May we save our future children from pain and stress. God bless you now. Until next week Saturday. Una bye bye.